Hello, everybody. Thank you for joining us today on our webinar for PCOS, the 5 Ws, where you're just going to jump right on in. So I want everybody to think a little bit about why they're here today listening to this webinar. Whether you have experienced one of the symptoms that you see listed below, being overweight, having issues with infertility, having to deal with multiple ovarian cysts, sex hair, diabetes or prediabetes, or even something else, hopefully this webinar will help to give you a little bit of insight about what PCOS is and where it came from and what you can do to manage it. My name is Dr. Courtney Sims, and I'm a private practice gynecologist who practices in Houston, Texas, and a large majority of our patients deal with PCOS, so that's why it was picked as one of our 5W topics. So the 5W series breaks down into the what, the when, the where, the who, and the why in terms of a disease. So for PCOS, we're going to break down the what into 3 different parts. And so we're going to start with what is PCOS in terms of a definition. PCOS stands for polycystic ovarian syndrome. It's also referred to as Stein-Liebenthal syndrome, although most people are not going to see that if they Google it or if they're trying to get more information about it. That's more of a medical term. The more lay common term is PCOS or polycystic ovarian syndrome. And whether or not the hormonal imbalance causes an insulin resistant issue or you have insulin resistance that causes a hormonal imbalance, it's kind of a chicken egg phenomenon that PCOS patients deal with. But the long and the short of it is they have to deal with both. They have to deal with hormonal imbalances that likely result from insulin resistance because their cells are more insulin resistant, which means that whenever they eat, whenever they drink, their organs are supposed to release insulin, and that helps the sugar from the food that they are eating get into the cells so that their cells can use it for energy. The problem in PCOS is that those patient cells are insulin resistant. So it's almost like having a boyfriend that you don't like, and the insulin is the boyfriend and the cells are the girlfriend. The boyfriend tries to come over, the girlfriend is not feeling it, and so the boyfriends just end up being rejected. The problem is with insulin, your body can't just deal with that on its own or break it down. It has to get into the cell. So if you have too much insulin floating around in the bloodstream, then it's going to go down to our lovely ovary, which you see a picture of here. And this ovary is representative of an ovary of a PCOS patient. You see the classic string of pearls of the ovarian follicles that are around the periphery edge of the ovary. And what the insulin does is go down to this nice happy ovary and turn it on. The ovary is just a piece of glandular tissue, so it just simply responds to the hormone. So that's exactly what it does in PCOS. So it turns the ovary on, and then the ovary proceeds to make a bunch of extra androgens. Those extra androgens cause problems like the ones listed here. So the most common symptom of PCOS is infertility. People can also deal with extra hair, acne, pelvic pain, depression, diabetes, losing their hair, a host of different things. Now, not every PCOS patient is going to have everything on this list, but these are all of the things that can occur in PCOS. So where does this happen? Is this something that happens primarily in the U.S., in the Northeast? It happens pretty much everywhere. Up to 5 million women in America and up to 15 million worldwide are affected with this syndrome. And this cartoon here is very representative of how a lot of PCOS patients feel, in that the most common symptom is infertility, and you're just sitting there making ovarian cysts while everybody else is coming up with babies. It affects women from all backgrounds. It can often be misdiagnosed, underdiagnosed, or underreported. So if you think back to that first slide about thinking about why you're here and why you're looking at this, if you have a question and you see some of this sounds familiar to you, you see that you've had history with irregular cycles, you look at your face and you do have facial hair, then you should be questioning whether or not you actually have this condition. So who does it affect and when does it affect them? No one No one is immune to PCOS. I put this picture up here of Victoria Beckham to show that even celebrities have to deal with disorders like this. So it affects reproductive age women pretty much from the time that you go through puberty until the time that you go through menopause. This can be a condition that expresses itself. It may present at any time between puberty and menopause, and as we stated, up to 5 million women in the U.S., 15 million worldwide, and all backgrounds can be affected. So why does it happen? The true cause of PCOS is unknown, and I know that can be really frustrating if you've just recently been diagnosed with PCOS or you've been struggling for PCOS for a while, because when you get diagnosed with something, you want to know why it happened to you. But the reality is, for this particular condition, the true cause is probably somewhere between both genetic and environmental causes. There is thought to be some type of genetic link because we do see it in families where the mom or the sister or the aunt has had a history of PCOS, or a strong family history of infertility, or a strong family history of diabetes. But there are also other environmental factors that may be involved in the development of this disease, and whether or not obesity drives an increase surgeons in PCOS, or if PCOS has part and parcel helped to increase the obesity epidemic, that's again going to be a chicken and the egg argument. But for you individually, why should you care if you have PCOS? Because most women that I know are not running around upset if they don't have a regular cycle. It's not necessarily something that they look forward to having every single month. So if they happen to skip one or two or more, most women are not beating down the door to their gynecologist's office trying to find or bring their period back. However, PCOS is the most common cause of female infertility. So even though you may not care about where your period is now, at some point in the future, if you want to have kids, then you're really going to want to care about the fact that your cycle isn't coming on a regular basis. It can also be the cause of ongoing weight struggles and metabolic disease. So if you're a young woman who's been diagnosed with diabetes or high cholesterol or depression, or have been going and investing in a trainer and a gym and a nutritionist, and are just not seeing any kind of results, this may be something that you want to investigate with your physician to see whether or not this is something that you have. As we stated, it can be a cause of cancer. Those irregular periods, I know, not bothering most people now, but those irregular periods can also lead to overgrowth of the lining of the uterus. Any lining that overgrows can eventually grow into abnormal tissue, and that's how you get the increased risk of uterine cancer. And it can also possibly be passed on to your daughters. So even though it may not be something that you care about, I do encourage women to investigate whether or not they have this for the sake of any daughters that they have and daughters that their daughters may have, because it can be passed on. So why is lifestyle so important when it comes to PCOS? Because there's a lot of medical management of PCOS. A lot of PCOS patients will use birth control. They'll use metformin, Clomid, spironolactone, just to name a few, to try to manage their symptoms. But I'm a big believer in the root cause effect and looking at what are some things that you can do lifestyle-wise to really try to manage the root cause of whatever disease may be presenting. And PCOS is a very good example where lifestyle management can control and manage a lot of the symptoms of this particular disease. You have to look at what dietary changes that you need to make specific to PCOS. I always tell my patients there is overall general healthy eating, and most people want to eat healthy and exercise, but when it comes to PCOS, because of the insulin resistance issue that is ever present in that condition, healthy eating is not healthy eating that you can extrapolate all the way to PCOS. There are certain dietary guidelines that I recommend that I incorporate with my patients that are specific to managing PCOS. I also encourage people to dig deep into mind-body balance exercises, because cortisol is linked to an increased stress level. If your stress level is up and your cortisol level is up, then cortisol is also going to increase your insulin level, and this is already a problem with PCO. So finding out what you can do and using a program that can help you, give you some very specific advice about what to eat, what food groups to eat, what menus, what to buy, what ingredients to look for, hidden sugars, hidden refined grains in some of the ingredients for food that you buy at the grocery store. All of that can be very, very critical and essential in helping to manage PCOS. So my last what, and we're almost done here, is an actual, real tip that you can use today, that you can put in action today. As we said, at the beginning, I don't know if you remember or if I said my disclaimer in that this, of course, is a webinar, and, I'm not taking care of you personally. I haven't had that interaction yet with you, possibly personally. Maybe I have, maybe I haven't, and you might be listening to this as one of my patients, just refreshing yourself. But if you're not, then I don't take this advice as personal medical advice. I do highly encourage that you either find a local physician. You can reach out to us. We do consultations for PCOS patients both in person and online, and we have programs that work with people online as well, so it really works with your lifestyle. But the important thing is that you do link in with a professional that deals with PCOS quite frequently and does have a lifestyle management program for it, so you don't just end up on a bunch of medications. So I want you to find a program that works for you, and the tip that I have is specifically in regard to that picture that you just saw with the sugar. So 80% is the number that I want you to remember. 80% is the women with PCOS who are overweight or obese. That is a huge number. So by hopefully spreading the word about this condition, hopefully girlfriends will talk to girlfriends, sisters will talk to sisters, mothers will talk to daughters, and your periods and how frequent they are and how regular they are may not be something that you want to talk about, but just know if you happen to hear one of these people mention that in passing, you should hopefully remember this webinar, remember these statistics, and remember that, hey, that is linked to a condition that can be very serious, can have some very serious consequences. But the good news is there are lifestyle things that you can do to manage it. So what I want you to do to start managing PCOS on a lifestyle basis is to start to track your sugar. And you can do that through a variety. There's a ton of different apps out there. You can go old school and just use regular old pen and paper. But the number that you're shooting for is less than 35 grams a day. You do not want to take in any more than 35 grams a day of sugar specifically. And that is one tip that you can start using right now. So the good news is that PCOS can be treated often without medication, but unless you reach out for help, you're not going to get it. So the pain that you may have been feeling can't compare to the joy that is coming. And I would encourage everyone listening to this call to reach out for the joy of being able to manage the weight, the joy of being able to successfully conceive and have a baby, the joy of having your hair back, not dealing with acne, not dealing with irregular cycles, by managing PCOS via your lifestyle. As always, we are here for you. Crossroads strives to serve as a resource for PCOS patients in this particular condition because, as I stated, a large majority of our patients do deal with this. So if you need more information about PCOS, are interested in finding somebody to work with you to develop a lifestyle program that you can use for management, you need an online consultation, please reach out to us. We've put our contact information here, and we thank you for taking the time to listen to this presentation.